We mentioned yesterday, a new study suggests cervical cancer may soon no longer be a public health issue in the United States. It's all because of the impact of widespread HPV vaccination coverage and expansion of cervical screenings. NBC Charlotte's Carolyn Bruck takes a closer look at the research.
Cervical cancer is known to be one of the most preventable cancers, and now a new study says that a substantial increase in both screening and vaccination could prevent up to 13 million cases of cervical cancer worldwide within 50 years. That's why doctors say it's so important all women are screened for cervical cancer beginning in their early 20s.
By the time they're 21, 28, they may start seeing these precancer changes. So this is critical that that's when we identify this and treat it. Because if we treat these precancers, then okay, we're not going to develop cancers.
Cleveland Clinic's Dr. Robert DiBernardo did not take part in the study, but says screening for cervical cancer is crucial. In fact, researchers say a significant increase in both cervical screening and HPV vaccination worldwide could potentially eliminate cervical cancer as a major public health problem in 82% of the world's countries by the year 2100. In higher income countries like the U.S., they believe cervical cancer could be nearly eliminated altogether within the next 25 to 40 years. In contrast, the study predicts that if current prevention programs are not expanded, as many as 44 million cervical cancer cases could be diagnosed over the next 50 years. And the uptick in diagnosed cases could result in approximately 15 million deaths in less developed countries. The doctor says that an important part of cervical cancer prevention includes vaccination against the human papillomavirus, which is responsible for most cervical cancers. However, research shows that within the United States, HPV vaccination rates are lower than they should be.
This is a disturbing trend. So again, empower yourself, get the vaccination series. It makes total sense. And trust me, you can ask any of my patients who've had significant cervical dysplasia or even cancer, they would trade that in a heartbeat.
Cervical cancer is the fourth most common cancer in women, with more than 500,000 new cases diagnosed worldwide just last year. So again, the doctor recommends you get vaccinated against HPV if you are in fact eligible, because it could save your life. Carolyn Bruck, NBC Charlotte.